Therapists have asked for tips and tricks on immobilizing lower extremities with both comfort and consistency. We're answering. Here's some techniques and setups that will hold steady from sim to treatment. The first thing we're going to do is show you how we index our foot supports, just like we have for her knee here. So you have two options. First thing I'm going to do is I'm going to remove our comfort cushion here. I'm going to lay her foot flat. And we have one option would be to use these pegs. So if we're going to use the pegs, I'm going to position these kind of just under her ankle bone. And this will make a great indexing point for this mold care. The other option is to use a pre-cut profile that came from another extremity mask. So I'm going to place this one right here that goes right on the heel of her foot, just like that. And it kind of creates a backstop for her. And so now what we're going to do is we're going to place this cushion right under her, mold it to this.
Another tip I like to do for if you're molding a mold care, what I like to do is put these dummy profiles here so you have a place so the mold care doesn't spill over and take up those spots where your actual
mask is going to go.
Yep.
Just like that. And now what also this does is it maps out where this foot mask is going to be positioned, so there's really no thinking involved when you come over here to make that mask. So Justin's going to go ahead and get the mask. I'll get these profiles out of the way. And again, these profiles also mark where we are going to index that mask to. I like to do this profile first, just like this. And then we take the side profiles, drape it down. And you can see we're positioning these profiles as close to her foot as possible.
And how do you fold that?
So we'll take this extra material. You can either go on top or under, really kind of up to you. If you know where you're treating, maybe you avoid those treatment angles for that extra mask. And now we just mold this around her foot, apply nice even pressure. I'm gonna actually unfold this a little bit and make it a little tighter around here. So again, we have 3 minutes to mold these masks, which is plenty of time to make those tiny adjustments.
We're waiting. I'm just gonna go ahead and throw the knee mask on there as well.
So one thing we like to do, and kind of our rule of thumb, is 2 masks for every site that we're treating. And basically what we're really trying to get at is covering 2 joints. So we have the ankle joint here. We're gonna cover the knee joint with this mask. I like this thick mold care because it does encase the whole ankle, which again helps limit that rotation, which is kind of what we're going for. But it's really up to you what you prefer.
Yeah, and that's what the great thing about this system is. Therapists can be creative as they want. It's kind of like a blank slate that you can come up with any kind of setup because extremities are tough to do. And we know that once you get 2 joints locked in like this, it becomes like less of a clinical setup and more of like a just image and treat
Exactly.
setup.
And again, with all these masks, you have to let it cure for that full 10 minutes. Any extra shrinkage, especially on these masks, they are thicker than our normal head and neck mask. So that shrinkage will be noticed by the patient. That full 10 minutes is really, really crucial to that reproducible setup that we're going for.
Yeah, how about we demonstrate off on just to see if it fits? Should fit, but let's check it out. Lift this leg up.
So go ahead and just bend your knee kind of like you would, like just completely. Yep, there you go. And then we'll set it back in there. So here you can see we got this nice index point where that goes. Boom, right in the same spot. We'll have her foot come right back down, squeeze in there, mask goes back on, nice snug fit. Pretty simple. So when you're notating for indexing, what I like to do is take a Sharpie and just kind of write right here. So we do have this grid system throughout the whole board. So this is at K10. So I'm just gonna write K10 right here, even maybe point an arrow to that peg. And then we'll do the same thing for the profile that the mold care is attached to as well. So that always goes in the exact same spot. And here you have it, lower extremity setup. Cake.